Well, obesity is an uncomfortable topic. Many of us suffer from it. In the United States, well over 2/3 of our population are overweight or obese. And yet, for all the time that medicine has been trying to address the issue with medications, with exercise programs, with various dieting regimens, the problem of being hungry all the time has not been solved by those approaches. And it's very clear now from many years of experience in the United States and worldwide that surgery actually does help these people who otherwise have very little recourse. And it's nice to offer something to people who are in such desperate need of help that will actually work. And the other thing that's evolved over time with experience has been the fact that we are more expert, more capable, more successful in terms of the risk of the procedure in the first place. And so we have a very low risk profile, not a zero risk profile. That's impossible with any treatment. But it's now become clear that you're more likely to suffer premature death if you don't have one of these surgeries than if you do. That's how bad obesity, left untreated, can actually be. Right now, and based on reviews by both the National Institutes of Health and the American Society for Metabolic and Bariatric Surgery, there are, roughly speaking, 4 procedures which seem to offer credible and provable benefit in the long term with weight control. And they are the gastric bypass with the Roux-en-Y, the vertical banded gastroplasty, which nowadays is only rarely performed, the biliopancreatic diversion, which is primarily a malabsorptive procedure but does have some restrictive components, and the laparoscopic adjustable gastric bands. Any patient who has a body mass index of over 40, and that's a number which is derived from height and weight ratios. Roughly speaking, if you're 100 pounds above your ideal body weight or in that range, you are potentially a candidate for bariatric surgery. Or if you're of a lesser weight and have a serious comorbidity such as diabetes, heart disease, sleep apnea, sleeping disorders, and or breathing difficulties, you might be a candidate even at a little bit lower body mass index near 35. When I first became interested in bariatric surgery, it was way back in my medical school experience. And I could see that this problem of being severely obese is very, very frustrating for the patients who suffer from that problem. In those days, we didn't even label obesity as a disease. It wasn't listed on the way we categorize illness as a disease process itself. Now, finally, it is listed under the current procedural terminology listing. Obesity is a disease. So that's changed. Also, treating obesity with surgery was something of a maverick venture rather than a mainstay practice some 30 or 40 years ago. I think that's changed dramatically. Now, bariatric surgery has reached its own natural niche in provision of medical care, and it's accepted and approved and sought after by more and more patients and their care providers, their family physicians, their orthopedic surgeons, their pulmonologists, their internists, their endocrinologists. All these physicians who care for problems directly linked to obesity are finding, hey, we can dramatically improve your health. Let's try this somewhat aggressive approach of surgery, and we'll get some good results out of it.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.